right, good afternoon. Today we're going to learn to do male catheterization first. So the first thing we're going to do is we're going to get our chart. We're going to look in it. We're going to find our order, make sure that we know what size the physician has ordered, 16, 18, 20 French or whatever. And then it'll usually tell us the reason that they want him to have a Foley catheter. Then I'm going to gather up my supplies. I'm going to get me a catheter kit. In this catheter kit does come a set of sterile gloves, but I do always advise that you take an extra set of sterile gloves into the room with you in case you make a mistake. You have them there and we're not sitting there waiting. You'll need a wash basin for cleaning your patient. You can also use the wipes or the disposable bath cloth. And then, of course, you'll need some clean gloves also to clean up your patient. So I'm going to wash my hands. Then I'm going to knock, knock, knock. Come in. Hey, I'm Angela from Bay Ridge College. How are you doing today? Good. Well, the doctor has ordered for us to put a little tube into your bladder to help drain your urine out. Would that be okay? Sure. Okay. Great. Well, first thing I need to do is check your identity. Can you state your name for me? Okay, Mary. And what is your date of birth? Okay, great. Just exactly who I am looking for. Are you allergic to latex or iodine? No? Okay, wonderful. All right, so we have our curtain pulled. So I'm going to put on some gloves because I'm going to clean the patient up. Okay. This is a very embarrassing procedure for the patient, so just please be mindful of that. If there's anybody in the room, I always ask them to step out. So it helps to get the patient lifted up, their legs lifted up, and then we expose them. There. If I was using soap and water, I would use it at the temperature like bath water, but in this case we're going to use the disposable cloths. We are going to grab the foreskin of the penis and pull it back, and we are going to go in a circular motion from the tip and clean it out. Going to discard. Depending upon how soiled he is, you may have to do it several times. Okay? Make sure you pull the foreskin back down over it. You don't want it just waiting there while you're getting everything else ready. Then I'm going to take the gloves off to dispose of them. Trash can. Okay. Then I would go and wash my hands again. Now, I have my sterile tray. I personally like to set my tray up here on the bed. So I take my kit out. This little plastic bag here is going to be my trash bag. So I cuff it and I put it somewhere that I can just set it up. Right there so it'll hold. Then I'm going to take my catheter tray. Spread their legs apart so I have room to work. I'm going to open this up from underneath. It is taped on the bottom. I open it up. Okay, remember, I have 1 inch on each edge to play with for my non-sterile area in case I need to move something around. Now, I do not have my gloves on at this point. That is okay. I am going to touch the tip of this little sheeting right here, and I'm going to hold it up. Only touching my corners. Okay, there's 2 sides. There's a shiny side and more of a dull side. And the saying I've always heard is shiny to the hiney. Okay? So you put this down under here. Do the best you can. You're wanting to not touch that because we want that to be our little sterile field as much as possible, okay? Now, I have a pair of sterile gloves right here. So I'm going to pick these sterile gloves up, and I'm going to bring them right over here. I don't have my back turned to my field, and I'm going to put on my sterile gloves. Now, this little piece right here, I just get rid of. I do not require you to use this piece, so I just drop it in my little can. Now, this tray, you can move it around any way that you see fit. Just got to stay within your 1-inch margin. Okay. So, we have our betadine. I'm going to open those up and set them right there. I have my lubricating jelly. I'm going to open it up and put it right there. Okay. And then I have my balloon, or my fluid that I'm going to put in my balloon. I take this off, the little cap. I come over here to my catheter. Slide this up so I can see right here where the little orange part is. And I'm going to watch down here at the end because you're going to see the balloon inflate. We're wanting to make sure it's working appropriately. Okay? Then I just let go. It's automatically going to deflate. Okay. Now at this point, I am going to remove this blue plastic. I caution you to be very careful when you're removing this because it will flop right off and your catheter will flop right out and become unsterile very quickly. So I usually come down here. There's a little perforation. I go ahead and I lubricate my tip. Then I come back around and I set it right back down here in my little box so that I know it is safe. Okay. Now I'm going to take. There are 3 cotton tip applicators in here. I would take one. I'm going to retract the foreskin. Once I have this left hand here on his shaft of his penis, it is going to stay there because that hand is now not sterile. Okay. So I'll take one. I'll do a circular motion. I'll put that one in. I'll do a second one, put it in. I'll do a third one, put it in. Now I'm done with that. Now also I'll make mention, remember when I tested the balloon a while ago? I left that syringe attached to that. You want to do that because you don't have enough hands to do everything. Okay, so now I'm going to pull this over here. I am going to start inserting. And with the male, you're going to go all the way till you get to the Y right here. But on this mannequin, of course, it will not go that far in. So we're going to say we're all the way in, and we should see urine coming back. At that point, once I get to where I'm stopping, I am going to take my 2 fingers over here, and I'm going to hold that. If I let go of it, it's going to slide right out. So hold that because you want to keep it there till you can get your balloon inflated. Okay, so then we would insert all of this fluid